Okay.
Hi, welcome to another episode of Can We Talk? We are in a third part of a four-part series looking at trauma. I'm Darcy Stanford with Southern Minnesota Learning RX, and today we are visiting with Amanda Starks. She is the executive director of Rachel's Light here in town. Why don't you tell us a little bit more about what Rachel's Light is, Amanda?
Yeah, so Rachel's Light is a homeless shelter for women and children. We are kind of a transitional program too. So what we do is we allow women and children to enter our home with different and various backgrounds. And what we do is we set them up for success to hopefully transition them to permanent housing and stay there.
Oh,
So we've
great.
been, yeah,
Great, because you guys have been in Owatonna for a little over a year, so it's a great resource to
yeah.
have, something that was really needed. And I'm sure you see a lot and deal a lot with different kinds of trauma, whether it's the adult women having a history of trauma, the children that they bring with them. And so, why
Mhm.
don't you tell us a little bit about that on how you see the trauma that they've experienced impacting them in their lives?
Yeah, so trauma is such a broad term for so many people. What doesn't seem traumatic to me can be extremely traumatic to somebody else. But across the board, we see trauma in anyone and everyone that enters our doors. I think that we all can say that we've been through trauma in some way, shape, or form. A very common diagnosis in women that enter our home is PTSD. Um, Anxiety and depression, and a lot of that is a result from trauma. uh, you know I like to explain it as, it can start as young as two. Something traumatic can happen to somebody and it's not handled or dealt with, and we kind of tuck it back in, and it keeps resurfacing because our brains learn that it's dangerous. So what we do is, like I like to say, it's like a fire alarm. It goes off in our head, and we're as humans, we want to survive. So we have the survival mechanism of trying to protect ourselves, which creates these patterns that might not look very healthy. And so over the course of years, or, whether it's dealing with abuse, I've dealt with a lot of women, or been with or worked with a lot of women that have abuse histories, whether it's, an alcoholic parent, or, just being exposed to something like that, some violence. It just creates this, our synapses in our brain, and everything starts working a little bit differently. So the fire alarm goes off a lot more, which causes triggers. So what we consider normal daily routines in our life can be very, very difficult for someone that's just trying to survive, or like they call the fight or flight response. So the minute that trigger happens, and it's usually from a traumatic experience, um, it causes unhealthy coping mechanisms to start settling in, which in return creates it makes a very hard way for women, especially if they're mothers of children or children, to go to school, to have a stable job, to be able to pay their bills. So it's just this downward spiral of, something that just happened from one traumatic experience or multiple. It just kind of depends. So we see that a lot at our shelter, and we try to, like the onion, we try to peel the different layers to help get to that root cause.
Good. Yeah, that makes a lot of sense. Kind of what I've talked about the last couple weeks reflects a lot of what you said, is that it gets to be a pattern, it rewires their brain and their thinking. They tend to be in um, that heightened sense, like you were saying, that
Mhm.
fire alarms going off a lot more for things, and that it's very personal. Every person's perception of an event could be different. It's not about the event itself, it's about the perception of the event that happened to them. And which is why for some people it might be hard, because you might have experienced it and be like, well, I'm not damaged by that. How come that person is? And it was all about how they perceived it. Do you find
Mhm.
that part of the struggle is breaking and getting that fire alarm to shut off or not go off as much for some of those daily things? Like, is it harder for them to transition into calmer, I wanna call it normal, but a calmer state?
Yes, absolutely. I think when that becomes your normal, again, that fire alarm goes off when calm happens, because your brain typically forms to that. What seems chaotic to me or you, that's their normal. And the brain definitely forms to those patterns, those behaviors, the toxicity. And so when calm and peace and things that seem very normal and what we would want happen, it really just starts triggering that fire alarm again. So it's kind of a double-edged sword. You don't want to have those feelings, but this is so scary because this is so unknown to me now. So again, that survival mechanism sets in. Like, that's scary. I don't know what calm and peace is. I don't think we should try that out because I'm very much stuck in this right now. So yes, it is really peeling that onion. It's really, I know, I think trauma and empathy really go well together. It's allowing people to feel that way, and not telling them how they should feel, and giving them that space. And when that happens, that's when the onion starts to peel a little bit. So yes, it's really hard to function in a heightened sense all the time.
Right.
And when you feel that shame, um, it makes it even harder and you close down more. So school or just getting up and showering, all those become significant things when they shouldn't be.
Okay. So some of the research that I have read and shared talks about when it's specific to cognitive and some brain function is that it can really affect like working memory, organization, attention skills. Do you see where that could correlate to some of the stuff that the women, particularly as adults that you're working with, struggle with?
Yeah, so one thing I see a lot is, especially in the kiddos that come in, is what would look like ADHD to us. So I specifically I had a kiddo that was all over the place, had a hard time regulating. He went through some significant traumatic events, witnessed some stuff that no one should have to witness, and the attention span and being able to remember something that happened or anything, was just not happening. But the therapist determined that it was all trauma, triggered by trauma. So yes, I do see that a lot with kids. And it's not, I'm happy that there's education going out, and there's people doing more research to understand that it's just not labeled ADHD, and we're not giving that diagnosis anymore. And it's been interesting to see how that works. I think, women have the same struggle. I think it almost paralyzes them because, how when you have all these elements going on from a traumatic experience or experiences, and then your brain's having a hard time functioning and being able to understand or hold attention. It's just, yes, I've seen it across the board, and it's been really hard to just function.
Right. I bet especially that organization piece. Um, Now
Yeah.
they're in a place as an adult, you have so much more you have to keep organized, whether
Mhm.
it's your bills and your children's schedules and all that kind of stuff that comes with being an adult. Organization and
Yeah,
then the
that's
trauma behind it could really just compound itself.
yep. So organization would be another one. I Organization, I've yet to see. It's either extremely organized to a point where it's a little OCD, or very unorganized and doesn't know, like medical appointments, can't remember which ones were set up, and you know, different you're applying for different housing applications, you're applying for jobs, and everything is so unorganized and all over the place. But I think that gives us an idea of what it looks like inside of them. So it's very, yes, organization is always an obstacle as well.
Yeah, and I know previously you've talked about trauma informed care, and in
Yeah.
education we call it trauma informed practices. And last week I had said one thing that made a difference for me and something I read was to look at a child and not think they're giving me a hard time, but they're
Hmm.
having a hard time, and why is that? Like, what happened
Right.
to you versus why are you doing that? And I
Right.
suspect you get a lot of maybe negativity directed towards you, or hostility,
Mhm.
frustration directed towards you, that's really not because of you.
Right. Yes, that is hands down the name of the game. It's the job. But I think it's very important, especially in trauma informed care practices, to look at the behavior or the pattern and really look behind it. So we can just stand on the outside saying that's just so disruptive and so angry and that's awful and they're bad. Or we can look at why are they really acting this way? What's really going on? And allowing, again, going back to that empathy piece, allowing them to feel. If we allow people to feel, they're going to feel like they belong. They're going to feel safe. And when people start to feel that way, it's kind of it's really amazing how things can start to form. It does take some time. It does take trust. I mean, trust is usually a big part of this too. Trauma really just breaks down a lot of different simple things that we probably take for granted a
Right.
lot of time. But yes, it definitely, I've seen violence. I have seen people direct something going on inside of them towards me. And again, it's just labeling that emotion and allowing them to feel because I can't imagine what it really feels like inside of them. And they need to get it out, and we're trying to do that, but it's definitely a process because it's years of this. And like we talked before, it starts, your whole brain starts to form differently and it becomes the normal and it's normalized. And um you I don't blame them.
Right. And the earlier the trauma, the more it's ingrained in them. There's definitely shows when the trauma happens at 2 versus when you're 22, that how it
Mhm.
really can alter the brain in some
Right.
significant ways.
Yeah. Brain development is huge. So if a lot of that's happening before the age of 7, it's significant. And you can see that a lot of the time in children. And it's really, especially when you're taught to not have feelings or to talk to people and explain that, and it's been shoved down for so many years, it really comes out in those adolescent teen years really, really ugly because they're just trying to cope. So you see things like drug abuse and different ways to cope with that. It's just yeah, it's not good, but
It's very
bringing
complicated.
awareness.
Yes, very complex. And like you said, there's multiple layers to it. And it does take patience, it takes empathy, it takes a thick skin to be able to do that kind of stuff. I think it's just nowadays that ability to empathize is maybe more important than it's been ever, because a lot more people are hurting, and
Mhm.
a lot of this stuff that's happening right now could be traumatic to somebody, even if it's not traumatic to me, and just how they're perceiving it. And so just being able to be that empathetic person
Mhm.
overall is a good skill to have.
Yeah, yeah, definitely. Especially in the world we live in right now.
Yep.
People, if we step back, we will see that there's just a lot of people that are hurting and they need to be heard. And it's not, they're not being heard. So they're dealing with it with how they know best. And just we need to be better. I think we really do.
Well, that's a great thought to end this on. Thank you so much for joining me. This is Amanda Starks with Rachel's Light here in Owatonna. And next week, I will be visiting with a parent who is an educator in the public schools. So she'll be able to share from that aspect, but also the parent of some children who have gone through trauma prior to coming to her home to share from a parenting aspect on how trauma, what they've seen, and how it's played out in their lives. So thank you again, Amanda.
Yeah, thank you.
All right. And we'll see you guys again next week on Can We Talk?